Good evening, everyone. Today, Dr. Murali Krishnan has joined us to discuss about coronavirus issue in Australia. Hi, Doctor. This is Vignesh. Doctor, as you know, corona is world-threatening at the moment. Can you please able to give us a small brief summary about this virus, like about the origin of the virus or the characteristic of the virus, just for people understanding?
So, yeah, that's a very good question that you're asking. The coronavirus, actually, it has been identified or started from Wuhan province in China. This virus usually affects the respiratory system. It usually causes flu-like symptoms, and then it infects the lungs. I should say affects the lungs. And then it can cause severe respiratory failure, and that is the one that causes death. Unfortunately, this virus is so contagious that it has spread throughout the world, and it has made the WHO to declare this as a pandemic. It's still going on, as you know.
Yep. Cool, Doctor. So the next thing is what's the current situation in Australia regarding the growth rate of new cases and recovered cases?
Now, I don't know the exact statistics, but my understanding with all the daily briefings from the government officials is saying that it's still active. The rate of new cases have fallen down. However, we are still looking at the we have not still gone to the peak. That is my personal opinion. We are still not out of the woods, or we are still not out of the danger zone.
Yeah.
Unfortunately, we don't know where the peak is, at what point the peak will be. So we just need to, follow the current restrictions. I'm hoping that the peak will reach soon, and once the peak reaches, it should come down. But the rate of new cases is tending to fall down, or showing signs of falling down. That is the current situation in Australia.
Okay, cool, Doctor. Thank you. So, what should people do first thing if they suspect they're having the virus? Like, whom to contact, or like what should be the first step?
Very good question. Now, as the coronavirus also causes flu-like symptoms, and we are in the starting of the flu season in Australia, it is very important for people who have the symptoms to call the coronavirus helpline. It is a free number. It is available from the Department of Health website. Anybody having flu-like symptoms should be able to access that helpline 24/7 and would be able to get help instantly.
Right. Cool. So, the next one is, what's the treatment method at the moment followed in Australia? Is like a symptomatic treatment or any other, bit more advanced treatment? So, what's the actual treatment at the moment?
Well, fortunately, for most of the patients who have been affected by this coronavirus or COVID-19, as it is officially named now, is symptomatic only. That means we treat as a simple flu, home remedies, isolation, social distancing, personal hygiene, practicing good cough etiquette. So these are the things that should be sufficient for people to recover fully. Again, I have to reiterate that people affected by coronavirus will recover fully. Most of them should recover fully, and the people have recovered fully also. But other than that, unfortunately, current evidence, there is no particular medicine or a treatment method which is going to cure the virus. It is left to the body's immune response to clear the virus on its own.
Okay. Thanks, Doctor. So the next is, I think it's a bit more, you should be a bit more close with this question. So what the major challenges like the healthcare workers are facing now in Australia regarding this corona issue?
It depends on the sector of the healthcare worker. Well, obviously, because of it's very contagious, the hospital healthcare workers are at extreme risk. Unfortunately, they're using a lot of personal protection equipment, being very, very careful when handling patients' body fluids, swabs, when they're doing the swabs for testing. They are the frontline workers, the hospital workers. From the primary care setup, where being a GP, I tend to face a lot of patients who have flu-like symptoms and who are worried that they have coronavirus. That is my area. So I initially screen them, ask them questions according to the guidelines set up by the Department of Health. Number one, whether they have arrived from overseas. Number two, whether there is any cruise ship whether they have departed from any cruise ship. Number three, what is the duration of the symptoms. Four, whether they have any other medical comorbidities, which actually determine the prognosis of the coronavirus symptoms. So these are the things that will determine how the disease is actually going to go. The healthcare workers, unfortunately, are at the front line of the battle. This disease, especially the virus, is very, very contagious. So that seems to be a bit more frightening and saddening to healthcare workers. As a GP, I face this every day. My staff, my nursing staff, my reception staff, we all use as much precautions as possible, mainly social distancing, screening the patients first. We are trying to do as much as we can. Unfortunately, the whole world is facing this situation, so we have to move on and then try to help people as much as we can.
All right, cool. Thanks, doctor. Thanks for your time and patience. Thanks for explaining things to people. We are very grateful for your time.